Namaste all. In Vata Vyadhis, the next disease we just completed Pakshaghat. The next disease which we will be learning is called as Manyastambha. Okay, Manyastambha. Short disease. Let's see what it is. The disease in which the muscles of the neck become stiff and there is difficulty in moving it is called as Manyastambha. So it is quite self-explanatory. Manya is the neck and Stambha is stiffness. Okay, Stambha is stiffness in this case. So the disease in which the muscles of the neck become stiff and become difficult to move. Okay, so this is quite common uh, in patients. So, but rarely patients, I mean, very few patients come to you for medicine unless they want to get relieved faster uh, because this is stiff neck is quite common and happens to patients uh, quite frequently. Then they tend to do something on their own and try to get relieved. So patients who have severe pain are not able to move the neck uh, at all and want to move on to work faster would come to you for uh, treatment. So let us see what Manyastambha, the causative factors are. Too much of daytime sleeping, sleeping on uneven surface. We saw this in Ardit also, sleeping on uneven surface. So the surface, the bed is not even. The pillow is too high or too low or no pillow or in uh, during sleep the position of the patient was not proper, uh, so that can cause uh, stiffness in the neck. Looking in the upward direction for a longer time, for a long time, so keeping the neck in one position, so be it in the upward direction or in the downward direction or in the sideways direction for a longer time can cause stiffness or muscle catch also. This is called as muscle catch also. So muscle catch, however, relieves faster or with less effort, it can heal faster, but stiffness will remain. Okay, so if suppose I'm looking in one direction for continuously long time, then the muscle of the neck tends to become stiff and cause pain. So looking in the upward direction for a longer time, similarly in the downward direction, looking in one direction, sideways, right or left for long time can cause muscle stiffness, sudden jerky movement of the neck. So usually now in the salons here, it is quite common in India that your hairstylist after the haircut they tend to do some massage. Okay, they call it massage. However, I feel that is more of harassment because they tend to do certain things which they are not taught. They just develop something by their own, or the salon owner teaches them something. So there is no science to it. There is no particular technique to it. It is just trying to impress the the client, and then they would do the beating movement on the neck, on the shoulder, press. Then they would have elbow massage on the neck. And one thing which they usually tend to do is releasing the neck. They call it releasing the neck, but at times they do certain things which can cause serious damage. So they will hold the neck in their hand of the client, and then they will twist it, neck twist. They will do it in this in various directions they would do. And the client, because everybody, almost 99% people have some or the other discomfort in the neck. And when there is sound because of the vertebrae, uh, because of the friction of the vertebrae on each other, then the kruk kruk sound is there, which tends to happen in the smaller joints also. So you do this, there is sound. So this is friction of the bone, uh, of one bone on the other. Okay, and because of that friction, there would be certain uh, blood supply which goes to that part of the body, and the patient feels relieved. And this is a psychology, I feel, more than anything else, that when this neck twisting happens and there is this sound, the client or the customer feels good. They feel, wow, this is so nice. I feel relieved. My neck is moving better than before. Okay, that may be just because of certain mild stiffness which was there, or because of the improved blood supply, they are able to move it properly. But even in chiropractic, so if in the initial days, if they are not very um, skilled or experienced in their job, they uh, because I've seen chiropractors doing this, the movement and the sound. See, it is a science, and I respect it. However, if it is uh, done heavily, it can cause concerns. But chiropractors are, they're trained professionals, so they know how to handle the complications, which the salon or the hairstylist they are not, or any people for that matter. Any person who feels confident that okay, oh, you have muscle discomfort in the neck, let me do a muscle neck twist for you, and they feel that they are really trained and experts and skilled at doing that thing. And in that, manyastambha can happen. The muscle, the neck gets locked in a certain angle. Okay, so that complication, the hairstylists are not equipped to do. They can aggravate problems. If there is small discomfort, it can go to severe stiffness or muscle spasm, sudden spasm. So that can aggravate the problem, worsen the condition. At times, the the if there is osteoporosis to the patient or to the person, it can cause fracture of the vertebrae also, and damage to the nerves, which can cause facial paralysis, ardit also. So trauma, when we say trauma to the head region or the neck region or to the nerve, not essentially it is an accident. These finer movements also can cause serious trauma to the patient, which the patient, uh, if they realize that it is due to this, then they would avoid. I mean, if the patient, if people know, if they are aware, if they are conscious that, okay, no, these movements can cause serious damages, they would tell the hairstylist, no, I don't want. So, as I go to a hairstylist, they would say, okay, I'll do this movement, that movement, I'll do massage, etc., etc. I say no to everything. I say, no, I will do it on my own. I have done my Abhyanga this morning, so I don't want any releasing of the muscle or the joint or a bone or anything, because it's not that I don't feel confident in their skill, but I don't want to take any chances. Hence, I say, okay, I'll do it on my own. or I do not have any discomfort, no need. So you may get patients who have done certain jerky movements. So few people also have a habit of moving the neck because of discomfort. So they keep moving this, they do this movement, sudden movement. Few people do this uh, neck twisting on their own, or few people do it by themselves because they feel that okay, they can do it by their own, which they would, out of 199 times they would do it good, and one time they would cause some serious problem to themselves. So in that case, the line of treatment for us remains the same, but causative factor wise, uh, patients who have uh, a tendency of breaking the joints as in the sound, they like the sound, and they keep doing this the neck movement, or uh, the back movement majorly. So they keep stretching, anti-stretching the back till they hear that sound, or they do a jerky movement to the leg in order to hear that sound, just to uh, soothe their ego, that okay, oh, I'm feeling good, I have done enough of exercise and enough of stretching, I'm feeling relieved. So that joint friction, that sound is due to friction of bones on each other. So that friction eventually, gradually, is going to cause problem, because every time that friction happens, whatever sneha is present in that region gets consumed. Whatever cartilage is present in that region will get consumed. Consumed as in the wear and tear will keep happening. So uh, if you find or come across a person or a patient who has a habit and tendency of doing this, you have to tell that it is only going to do harm to you than any good. Okay, so this should be told to the patient explicitly and very clearly that should not be done. It is going only going to cause you harm. If you want to do stretching of muscle, do muscle stretching. Don't wait for that sound to come. Okay, so sudden jerky movement of the neck, actively or passively, can cause manyastambha. Okay. So Hetu 7, we saw Vata Prakop as per Ayurveda and causes stiffness in the neck muscles and manyastambha. So this usually is a short and mostly a temporary process. Temporary as in short duration process, not temporary, I should say short duration process. So with minor or small duration treatment also, it will heal or cure better or faster. Most of the times patients actually don't come to you. They try to do it. They do uh, uh, the hot water bag, or few people do the cold ice pack, etc. And then they feel relieved on their own. Few people have a tendency to use the analgesic sprays. Few people have a tendency to uh, take muscle relaxants tablets, as in the medicine, muscle relaxant and analgesic tablet. So, because they are also not aware that there are certain better things which are available as solutions. So severe pain, what is the signs and symptoms? Severe pain in the neck muscles, like less or no movement of the neck, difficulty in talking, chewing, swallowing, and even deep breathing. Okay, so when they do deep breathing, it will pain. It will cause severe pain, discomfort. Uh, so difficulty in talking, chewing, swallowing, because all these will involve the neck muscles. We don't realize it, that for talking or for chewing or for swallowing, neck muscles are involved. You don't realize it till the time there is pain or stiffness in the neck. So patient, when they come, they will tell that I am having difficulty in talking or chewing or even breathing, deep breathing for that matter. Okay. So when there is locked neck, that time the pain is very severe. The patient comes to you crying because they cannot wait in or stay in that particular uh, position for long time. They are eager to move the neck to the other direction, and the muscles tend to become really sore after a certain time because they are holding the neck in certain position for a long time. So uh, the patient, this can be really serious at times. The pain, I would say, not the condition, but the pain which the patient is experiencing. So chikitsa wise, chikitsa wise, Snehana, obviously, Vishagarbha tel is good for pain. We saw this in Amavata also. So wherever there is pain in the joint or muscle, Vishagarbha tel initially till the time the pain subsides is good. So when the pain subsides, you can shift on to the other oils because Vishagarbha is too heating. So when the pain subsides, you can shift to even plain sesame oil or narayan or bala or whatever oil is available. So for stiff neck or stiff muscle, Vishagarbha is not required. But when there is pain, Vishagarbha is good. And as it subsides, you can shift to the other oil. So narayan oil also it goes is also good. Swedana, Nadi Swedana is good. And the Shamula, with the Shamula decoction, if you do, is good. Apart from that, if you tell the patient they can use hot water bag in their house when they go back from your clinic. So Snehan, Swedan, Gandusha with sesame oil, Narayan oil or Bala oil helps. So Gandusha is good for concerns related to the neck, concerns related to the mouth, the buccal cavity. Uh, Gandusha should be recommended. Okay, so even in degenerative uh, diseases of the neck, like cervical spondylitis, there Gandusha will help better. Okay, will help good. Shamana Chikitsa, Vata Vidhwans Ras, Samir Pannag Ras is good for Anuloman, Gandharva Haritaki. Just to mention here, through uh, after seeing patients, we have realized that patients who usually have uh, problems with passing motion or constipation, Malavashtamba, they tend to get stiff neck very fast. Okay, so the pratiloma gati of the Apanavayu will lead to this neck stiffness too often. Okay, so they have, of course, stiffness in the back as well, but neck stiffness because we are learning Manyastamba. So, having stiff neck or frequently having stiff neck will be one of the symptoms which will be seen in Malavashtamba. So, Gandharva Haritaki or Anulomana, Mrudu Virechana is good in such patients, and in Manyastamba also, uh, Gandharva Haritaki or Mrudu Anuloman, Mrudu Virechana should be given, okay, in order to alleviate the Vata. Pathya Vata pacifying food and lifestyle, snigdha, soft, warm, and semi-solid food. Okay, so till the time the stiffness or the pain remains, semi-solid food is advisable. Warm food is advisable because it is soothing. So anything if they have to chew will be a problem for them. So give them semi-solid food or ask them to eat semi-solid and warm food. Okay. Anything if they have to chew is going to worsen the problem. Okay. And snigdha, because we have to alleviate vata. So snigdha, soft, warm, and semi-solid food. Okay. Apathya, vata aggravating food and lifestyle. Hard to chew food is apathya. Too dry, ruksha, should not be consumed. So, what is it called? Popcorns. So, those kind of things should not be consumed because they are ruksha. So, even if it is, say, maybe soft, but it is ruksha, should not be consumed. Cold fluids should not be consumed. Exposure to cold air. So you should always ask the patient to keep warmth here. Okay, cover the neck with stole or whatever warm clothes they have should be done. Keep the ears also warm so that there is no aggravation of vata in that region. Why ears? Why ears should be covered?
Because that's related to Vata. The organ that's related to Vata is.
Yes, very good. Yes, so Pakvashay Kati Sakti Shrotrasti Sparshanendriyam. Okay, so Shrotra is the Karna. So these are the shlok, the verse which I said are the locations of Vata in the body. So ear is one of the organs related to Vata, as uh, Nicole said. Very good. So it should be covered in Vata diseases. Whatever Vata disease the patient is undergoing, covering the ear is going to only help and benefit the patient. Even if they don't understand why it is to be done, you have to tell, just do it because I'm telling you to do. Okay. So covering with the cotton plugs, also covering it with warm uh, some clothing, woolen clothing or warm clothing or earpieces. It is going to only help the patient. Okay, Ayurveda perspective, Shrotra is the sthana of Vata. Okay, so cold air exposure, cold food fluids, we already saw. If there is any other query or input, if you have to give, because this is quite a common concern. If there is anything which you have done in the past before coming to Ayurveda, if you have done or if you have seen somebody else doing it, your family member, uh, like a solution to when they had stiff neck, you can share. No? Okay. Fine. So with this, we cover Manyastambha, a short disease. But sometimes you would find patients coming to you with the concern. Okay. With this, we cover Manyastambha. Thank you.